Good morning, everybody.
I feel like I haven't seen you in 20 minutes.
I know, Greg. Morning, Don and Ellen. And Don's here. Shulamit. Oh, we saw your cat a minute ago. Now it's gone. You're muted, Shulamit, but that's okay. Hey, Ruth. Hey, Rosalie.
Believe me, you prefer that.
I don't know. Marion, good morning. Hey, Scott. And Jenna and Rick and Nikki and Jen. Thank you guys for being here.
Oh, it's almost 10:02, our typical 2-minute past start time. So I'll go ahead and get us rolling. I'm sure more people will join in because they know I usually don't start till 10:02 and they take advantage of that. So good morning, everybody. Good to see everybody. Happy Thursday. Thanks for joining us for our weekly community call. We have some special guests this morning joining us as a result of requests from all of you about topics that are important to you that we need to know more about as a community. And so we've responded to that, and I'll go ahead and let Brian make the introductions. But I just want to tell you that's the purpose of today's call. And unless anybody has any questions for me, I will turn it over to Brian.
And I'm going to turn it over to Dawn Beasley to do the introductions.
Good morning, everyone. It's my pleasure this morning to introduce Kate Copen and Jenna Brofsky. They are both senior associates at the St. Louis and Kansas City offices of Husch Blackwell. They advise employers on compliance with federal and state employment laws, a gang of other things. And they're both experienced litigators in labor and employment cases in state and federal court. Both Ms. Copen and Ms. Brofsky have spent a lot of time during this pandemic advising clients on the dynamic of the COVID-19 workplace, providing guidance from CDC, OSHA, and so on. So I think we're in very good hands this morning, and I will turn it over to them.
Thanks, Don. Good morning, everyone. I'm Kate Copen. Like Don said, an attorney at Husch, and I've been working with Federation for years now on various employment issues. And my colleague Jenna Brofsky, she's kind of gonna take the lead on this call. She's really one of our experts on these COVID-related issues. So I'll turn it over to her, but just wanted to say a quick hello.
All right, and I'm Jenna. Nice to meet you all. I'm in the Kansas City office of Husch, currently in my house, just on the Kansas side. And I've been doing a lot of advising on this topic. I know folks are eager to kind of get back to it, back to in-person meetings, back to big events. And so I'm here today just kind of to give a legal landscape and answer questions best as I can. Important note, I'm not here to give legal advice. So typical disclaimer here, nothing I say is intended to be legal advice or should be construed to create an attorney-client relationship. Again, want to help you think about some things, or maybe you're already thinking about these things as you come up with your own plans to reopen your workplace. So big picture to be thinking about, right? We have a few places, specifically St. Louis County, that still has pretty strict orders in place. And when I say pretty strict, I don't mean that in a judgmental way, but relative to other areas in Missouri and this area. So we have kind of rules of the road, and then we have public health guidance and CDC, and that's changing. And those aren't always on the same page. There's kind of a disconnect between the law and the science right now that maybe some of us have started to notice in terms of what to do about folks who have been vaccinated, for example. So on the kind of first topic of what are the laws that are in place that we're subject to right now in St. Louis County, actually earlier this month, it was the 8th, there was an amendment to St. Louis's stay-at-home order. And if you haven't seen it, it's probably worth checking out. You can find it at stlcorona.com, where you could probably Google some of those words and find it. And it does apply to businesses, and there are some occupancy limitations there, and there's some stuff about face coverings. And I think it's worth noting that there's also a space on the county website for anyone to report any violations by businesses of that order. So there could be enforcement, and that's why it's important to understand, what you have to do under those laws. If we zoom out to kind of Missouri more broadly, we know that there's not right now a stay-at-home order or any kind of mandate. Interesting to note, there's pending legislation kind of trending in the opposite direction. So there's been legislation introduced to create a COVID Bill of Rights, is what it's called. And if that were to pass, and I certainly can't predict that it would or wouldn't, private businesses would not be able to mandate vaccines, for example. So there's this movement kind of all across the country to introduce these type of bills. We'll see what happens, but it's worth kind of staying on top of that and knowing what's coming or what could be coming. The other kind of law, so we talked about like the county, talked about the state, federally and the state, there's anti-discrimination law. There's anti-discrimination law that applies to employers, and there's anti-discrimination law that applies to places of public accommodations. And there are certain carve-outs for religious entities. But it's good to be thinking about, okay, if I'm doing this new policy and I'm requiring people to get tested or vaccinated, how do I make sure I'm also complying with anti-discrimination law? And then, of course, we talk about all the law, then we have the public health guidance. And it is just guidance, but it's real and it's changing and it's hard to keep up with. Now that vaccines are pretty much open to the masses, a lot of the questions we've been getting is, can I mandate vaccines for my workforce? The big picture answer for private employers is yes, but there are certain exceptions you'll have to provide. And at the end of the day, it's really up to you and your workforce, understanding kind of what your workforce is interested in and if this is going to be a good thing for your workforce. So the last kind of consideration I'll throw out there, we talk about the CDC guidance. There's also an entity called OSHA for all employers out there probably are familiar with, the Occupational Safety and Hazard Administration. They also put out guidance at the end of January for mitigating the spread of COVID in the workplace. And that's something I recommend you take a look at too. Basically, employers, it recommends, and best practice would be to have a policy in place. Whatever it is that you decide to do, write it out, make sure employees are understanding it. That guidance, I would say, is a little behind the science. And so we do anticipate there's going to be new guidance coming, maybe this month even. So a lot of this is changing and shifting, but knowing kind of the key players and where to look is half the battle. So I'll stop there. And if folks have questions or want to talk about things, Kate and I are available. Thank you for having us.
What was the last resource you just said for guidelines and practices?
OSHA, Occupational Safety and Hazard Administration.
So we brought these individuals on at your request to talk about stuff related to the pandemic and return to work or whatever it might be. So questions.
Yeah, I'll ask a question. So Jenna, as we evaluate the science versus OSHA, I think you had told me in our prep call that OSHA is just the guideline, and if we run the risk of what our risk is if we go ahead and follow the science with CDC.
Yeah, so I think Don's referring to specifically in the context of what do we do with people who are vaccinated. So right now, OSHA's guidance is that you treat everyone the same, vaccinated or unvaccinated, in terms of wearing masks and social distancing. We know that that's not exactly what the CDC is saying right now. And like I told Don, the kind of backstory to OSHA is with the change in administration, there was an instruction for OSHA to provide an emergency temporary standard. So that's a law, has the force of law. They haven't done that yet. They might do that. Right now, what they have, to Don's point, is just guidance. What's not just guidance that comes from OSHA is this general duty that employers have to keep their employees safe, to create a safe workplace. And that is something that you might have heard about. The contours of that, what that exactly means, we'll see how that plays out in court. But the idea is you do always have a duty to keep your workforce safe. Now, if you're doing that in other ways, right, like social distancing and work from home, the risk perhaps of not following one point regarding vaccines that Don and I talked about is likely lower. But it's something you should be looking at holistically. And the OSHA guidance that I mentioned, there's like 16 or 17 different points to that. So that's vaccines is just one point of that.
So just as a follow-up question to that, I'm sorry if I could, well, if we establish a guide that has different rules for vaccinated staff versus non-vaccinated staff, is how much of an exposure is that? Again, following CDC guidelines.
Right. So I'm not going to give specific numbers or legal advice, but best practice is to follow both the CDC and OSHA. We're in this moment where OSHA is likely to update again soon, but I'm risk averse. I'm an attorney. I always say follow the law as best as you can. So at this point, until OSHA puts something else out, I trend on the side of saying, in meetings, everybody's wearing masks. And part of that is practical too. And it's, role models. What's the kind of climate that we want to be setting? Are we asking people that they've been vaccinated, or are we just trusting them? Because then you run the risk of somebody saying, oh yeah, I've been vaccinated, and they're not. And I think at this point, January 2021, this year was actually the deadliest month of the pandemic, which I hadn't realized. So there's still a really big risk out there. And best practice would be to stay with this OSHA guidance at this moment in time.
So I have a question. Can you have different policies for different groups of employees in terms of how you do this? So we have employees that come into an office. If they are exposed or whatever, they can work remotely. We run a resale shop, they can't work remotely. And, how do you handle all of the PTO issues and things that come in with regard to that? Because it's two very different types of jobs. And so we're struggling with how to be equitable in our policies, given that situation.
Ellen, can I piggyback?
Sure.
What about the category of volunteers?
Well, same thing. Volunteers coming in our office are going to follow the same guidelines
Right.
as our staff coming in the office. They're going to wear a mask, they're going to take their temperature, they're going to do all of those things. I'm more concerned about, what happens if somebody gets sick or somebody is exposed, and how do we manage it? And what happens if they run out of PTO, and, all of those kinds of things that are going to come up.
Yes, yeah. So there's a lot in there. It's a good way to distinguish between employees based on job duties. So you want to be treating similarly situated employees the same. So I imagine you might have job descriptions, and that's always something to look back at. And if the job description is you have to be in the thrift store, 3 times a week, it's going to be hard to say that person can actually work remotely. So that's a legitimate basis. You just want to make sure you're treating people in the same category the same. It might make sense to have different policies for different categories of folks. There's not an inherent issue with that. In terms of kind of PTO, things to think about. I don't know if folks on this call have decided to opt into the federal paid leave law. It was called the FFCRA, Families First Coronavirus Relief Act. It was mandatory for a time period. It's not anymore. A lot of small employers didn't do it because there was some exemptions, but it is an option now. It goes, I believe, through September. Yeah, Kate's nodding her head. And that is a situation where if you provide paid leave for certain qualifying reasons related to COVID, including the person has COVID, the person's going to get a COVID vaccine, the person gets sick after they get a vaccine, you provide that leave and then you get a tax credit for it. That's kind of broad strokes of that program. Even the CDC says if you don't use that program, they're encouraging folks to be flexible with PTO. And from an employment standard, I mean, it makes sense, but also we want to make sure we're not being discriminatory in how we implement that policy. So having a written policy is really critical at this moment in time. As to volunteers, you know, Ellen, your point makes sense, treating volunteers like you would employees in terms of what you're requiring or not requiring, because I think where the risk is as an employer, you have this duty under OSHA to keep your employees safe. And if you say, employees, you have to do all these things, but volunteers can just come in here and do whatever they want, that could be a problem with your duty to your employees.
Thank you. That was helpful.
So I had a question. Go ahead. I'll go next.
Yeah, go ahead.
Okay, hi. I'm Jen Schmitz. I work at Covenant Place, which is a senior living community. And the question I had was specifically about temperature checks. So what I heard you say was it would be okay if there were certain job classifications that we did daily temperature checks for, and we didn't do it for other types of roles, but we can't discriminate based on who's had the vaccine and who has not had the vaccine. That would be considered discriminatory. Is that correct?
Pretty much. At this moment in time, because OSHA hasn't changed their guidance, I'd be careful about the last part, just making decisions based on vaccination status. But to your point, yes, if we're making decisions based on legitimate business needs and not, you know, protected categories, that's usually safe. I think, and I don't know, in your business, if you're doing testing, it probably is tied to how often people are coming into the facility or how often they're exposed to vulnerable populations. So you should just think about, yeah, kind of how you're making that decision making, and if it's people who are in the workplace versus people who are able to work from home, right? We don't need to be testing those folks who are working from home all the time. I don't know if it makes sense, you know, if you could say, doctor, you test this much, and nurse, you test this much. I don't think that makes as much sense.
Actually, yeah, your assumptions are correct. It's like office workers versus the maintenance staff that goes into the units. So that would be a good distinction. Okay. And then can you also speak about waivers, liability waivers? And we have an existing liability waiver, and so we've been looking at updating it for COVID language, and I'd like to get your input on the importance of that.
Yeah, so when we talk about waivers, there's a difference between for our workforce and for other folks, because this duty that you have to keep your workforce safe isn't really waivable. You can't really get somebody to say, I agree to work in a place that's unsafe, generally. That said, folks are still doing them for their employees. What I've been, and what Kate, I'm sure, has been helping with too, is waivers for if you're having an event and you have folks coming in and you want them to say, I waive liability around COVID, which you can do. You can do that. And I think it sets a good tone and it makes people think before they come to the event. Missouri, I believe they passed something related to limited liability for businesses, but it's not implemented yet. So that's worth also looking into. But regardless, having a waiver for non-employees is in COVID times is something we're seeing and generally a good practice.
I'm less concerned with kind of controlling things around the staff because we've got a pretty small staff, but our members, you know, is is we are looking at opening up more, having more congregants in the building, guests in the building. On kind of our, I don't know, our responsibilities there, our ability to require vaccines, not require vaccines, or, you know, proof of it, you know, just sort of managing that piece, and kind of legally what our options are there.
Yeah, absolutely. So vaccines, if a state, Missouri, well, we'll just take Missouri because I assume you're all in Missouri, hasn't said anything about, like, you might have heard the governor of Texas and the governor of Florida talking about vaccine passports. I haven't heard Governor Parson talking about that at all yet. So setting that kind of aside, employers can mandate vaccines subject to federal anti-discrimination law. That doesn't mean that you won't get claims and people saying that they don't want to do it, but the EEOC, the Equal Employment Opportunity Commission, is the federal agency that's in charge of interpreting anti-discrimination law and enforcing that law. And they've said you can require COVID vaccines at this moment in time if you leave space for exemptions for people who have disabilities or sincerely held religious beliefs. Those are the two categories that you want to be careful about. And for those folks, it doesn't mean that you have to it means that you need to have a conversation. You need to figure out what's a reasonable accommodation, and you might do that already in other aspects. And it might be something like wearing masks or wearing masks and testing. Now we're also talking about public accommodation space. When you're talking about congregants, non-employees coming in, there's also anti-discrimination law at the federal and the state level. Kate, do you want to talk a little bit about that?
Sorry, were you talking about the public accommodation or the employment aspect of it?
About the members coming in, which is the non-employment side.
Yeah. So in general, religious entities, places of worship, are exempt from the public accommodation laws under the ADA, the Americans with Disabilities Act. So, you know, if someone so for example, you might have a policy where you require, you know, members of the public who come in to use a place of worship to show proof that they're vaccinated. And, you know, if someone says, well, I can't get vaccinated because of a medical reason, I mean, if you're a religious entity, then you are exempt from the laws that would require you to accommodate that person. So potentially you could exclude that person from coming in. Again, this is, we're not talking about employers here. We're just talking about places of public accommodation and religious entities, in other words, places of worship. So, you know, but you know, whether you have to do something under the law is obviously different from, you know, whether you want to or should. I mean, obviously there's a lot of different factors to balance, and you want to be accommodating to people just from a human, you know, point of view. So, but hopefully that answers your question a little bit with respect to members of the public coming in to use it as a place of worship.
And I think another thing, surveying your membership might be a good idea to get a sense of where people are at and how, you know, now that the vaccine's more widely available, we're going to see more people getting vaccinated. We've also been doing or encouraging education campaigns from entities. The Missouri Department of Health website has some good information on there, just like Mythbusters. You know, vaccine will not put a chip in your body. Really just basic stuff like that. So if you are of the mind where you are encouraging people to get vaccinated, there's information from the state out there, from the county out there. And I was doing some research into these annual trust surveys that are done every year, actually. And basically they say how much trust individuals put in different entities. And employers were at the top. Your own employer was at the top of trust for COVID information, and 3/4 of the people surveyed, this was in January, said their employer was a mainstay of trust on COVID issues, more so than the government or just general business leaders. So I thought that was some interesting research.
Jenna, can I go back to the last question, maybe with Kate? With clients at a social service agency where they don't, excuse me, they're not residents, so they may come here for counseling or for testing or senior services. we haven't had a lot of clients here, but we take their temperature and we do a health questionnaire. Since we're not a religious protected, environment, what would you recommend going forward without making a recommendation?
Yeah, sure. So if you're not a religious entity, then you would be subject to the public accommodation laws, which say you do have to accommodate people with legitimate disabilities. So, if you have a policy where in general only vaccinated people can come in, but someone cannot get vaccinated because they have a disability, you would have to potentially accommodate that, as long as it's not placing an undue hardship on the business. And that's a very fact intensive inquiry, whether something places an undue hardship on the business. Accommodating someone in the public accommodation context is very different from the employment context. If an employee needs an accommodation, you engage in this interactive process with them and you find out all this, information about their specific medical condition and their limitations and all of that. When you're dealing with a member of the public, you can't go into all those details. You can only really ask, do you have a disability, and what's the accommodation you potentially need, and then you determine whether it's it would be an undue hardship. But you can't even ask what is your specific disability necessarily. So so I guess the basic answer to your question is right. If you're not a religious entity, you would potentially have to accommodate people with disabilities.
But we can ask, we're not there yet where we would ask them to be vaccinated, but we've been asking people to mask and to socially distance, and we've set up our operation so we can. Excuse me, so it hasn't been an issue, but we can continue to make sure we can require that their temperature is taken, or they can't come in the building, or that they answer a questionnaire or they can't come in the building.
Yeah, and I can't imagine any situation where someone would say, I can't get my temperature taken because of a disability. I don't know what that would be. Potentially a mask if they had some sort of breathing issue, but yeah, that's fine. The temperature checks are fine.
Thank you.
So I had a question in regards to, from what I understood is that we could not mandate the vaccines because it has not been federally approved. It was approved under an emergency usage. That's how we've been guided. So what you're saying is that really we can mandate it now because we're exempt if we're a religious organization. It doesn't matter what the federal law says.
Yeah, and Jenna, if you want to speak more to this, but certainly from an employer can mandate vaccines.
I can speak to the emergency use authorization piece, what you just spoke about.
Right.
So, normally vaccines get FDA approval. These have emergency use authorization, which are 3 out of 4 levels of testing. So still kind of a ton of testing that's done. The question that's been raised by some is whether, because the actual vaccine, when you get the vaccine, it comes with a piece of paper and it says on that piece of paper, you don't have to get this vaccine. Essentially, you have the right to refuse this vaccine. And so people have said, because it says that, there can be no employment consequences as a result. And I think that's a poor analysis, and that's kind of what most folks have been thinking, meaning that you can refuse to get the vaccine, doesn't mean there's not going to be employment consequences as a result of it. You don't have a right to work for your particular employer, so you don't have to get the vaccine, but that may mean you can't come work in the office or your employment might end. So you're right that there is certainly language or arguments out there as to why there's some difference between vaccines that are fully approved and those that have emergency use authorization. But where we've come down on it, and where I think most attorneys have come down on it, is that that's not for private employers a real argument. Setting aside any fact that you're a religious entity, but just for all kind of private employers, we're not really concerned with this that argument. There is litigation. I'm not going to hide that in the public sector for employees who've been terminated and are making that argument. But again, it's just an argument. And like I said at the beginning, everything is changing so quickly. And we don't have case law to look back on and say, this is how it's been interpreted in the past.
And that also then goes to when we open for worship, are we able to actually say only vaccinated people can attend the worship services? Is that how you're interpreting? Like, yes, we can mandate that?
So on the employee side, I keep separating them because they're different legal.
I'm talking about the public, like to let the public come in.
Yeah, so as of now, you should be able to do that. I say as of now because, again, states can jump in there and say, actually, no, and that's what Texas and Florida are trying to do. But absent that happening, I don't see a reason, unless Kate disagrees, why that can't be a policy that you go about, and then keeping in the back of your mind, anti-discrimination law, do I need to accommodate anyone with a disability?
I had a question about hiring new employees. During the interview process, are we able to ask like whether or not they've been vaccinated, or, I recognize going forward, like starting out, we can mandate to our current employees, but going forward with new employees, I'm wondering if there's a difference in how we can handle those situations.
Do you want me to take it, or you want to take it?
Go ahead.
If it's a condition of employment, meaning if you have all your employees and you're requiring that, you can certainly ask if that person can meet that job requirement. We always say tread very, very lightly on asking anything related to health, unless it's job related. There's language under the ADA that talks about kind of what you're allowed to ask. But if you're saying that your workforce, you're already requiring that, it's okay to ask somebody if they can meet the requirements of their job. Now, if you're asking, oh, go ahead.
Actually, you misunderstood. We're not requiring it of our current employees. It's optional. So that would then be different for when we bring in new employees?
Yeah, if it's not a condition of employment, I would not ask that question. That could be perceived as discriminatory.
Okay.
I apologize for that confusion.
But I do wonder, Jen, if like right now we're not requiring it either, but we're also not going into the homes of our older adults yet because of the risk. And when they do go back in, it is going to be required of anybody who's going to go back in. So at some point, although now they're all vaccinated, so it's not an issue. So it speaks to whatever you were just saying, Jenna, since everyone is required to have that, they all are vaccinated. Anyone new coming in will have to be, but at the same time, is there some subtlety there? Let's say that wasn't the case and they can't go in, they can't do the job, but maybe Jen, you don't have that. Maybe they are still doing the job right now with your clients, unvaccinated. Okay. I guess it's different.
I would just tread really lightly on anything you're asking applicants that could touch on disability or health related information.
Good question. So we're struggling with the situation where people that have had vaccines are still uncomfortable coming in to work in the office. They can do most of their jobs, not remotely, but we feel like we want to start having more of a staff presence and still maintaining social distance and masking and all of that. I know it's just a gray area, to what extent are people's feelings and being scared even with the vaccine, should they be factored in?
Yeah, so much of employment laws is the practical considerations here. You as the employer have the right to require somebody to do their job if they need to do that job in person. So you can certainly do that. Now, if the person says, I don't think it's safe, you might be dealing with some claim of some sort there. Not that it's full of merit, but that is something, there's administrative burden to dealing with that kind of situation. But it's it's all about collaboration, figuring out with folks, you know, what makes sense. If they've been working from home for the past whatever, have they been as productive? Is there a way to measure their productivity and say, well, you'll be more productive in person? At this point too, I don't see many employers, a lot of employers are giving the option, and not many employers are requiring folks to come back. So I'd say slow and steady, collaboratively, but you do, if somebody needs to be in the office, at this point, you can say, this job requires you to be in person. And if they say, I can't do it because I don't feel safe, you engage in a dialogue with them, right? You see if there's actually a disability or if it's just a feeling. And that feeling isn't legally protected, though there are, you know, real reasons why you might want to be sensitive to it.
Other questions? It's a resource you have access to. It's going to go away in a minute or two. If you don't ask your question, you should not hold back.
You know, I was just kind of mulling this over in my head. I'm not even sure what the question is, but balancing that legal requirement to keep our staff safe with whether or not we require members to interact with the staff to be vaccinated. And because if we don't require them to be vaccinated, or to say, you know, we'll meet with you if you've been vaccinated, or, you know, I don't know if you kind of see where I'm going, but it's that kind of hard balance, because we're, you know, we're small staff, you know, many members, right? we have less control of the members, but we still have that obligation to keep our staff safe with those people we have less control over.
Yeah.
So I was just kind of mulling that through as you were saying some of this.
That's right. I think you talk to your staff and see kind of what their comfort is. When you're kind of balancing those things to consider, right now we're still under this emergency declaration federally. So you still have that in your, on kind of one side of things. And you also have, you have the St. Louis County, if I don't know if you're located in the county, but there are actual, you know, occupancy limits in place for businesses. So you do have to follow that. And then you have the practical, we want to return to business. Folks want to come in. So I would say, see what your staff, you know, feel out your staff. What are they thinking? Are there ways for them to be, you know, setting up an event and then, you know, not being present perhaps during worship or whatever it may be? I think it's really going to be a work through this on a case-by-case basis.
So I know that a lot of synagogues are going back and forth about whether or not to require people who come into worship to be vaccinated. I've seen HIPAA come up as a question, you know, are we allowed to ask people, and are we allowed to ask for proof that they've been vaccinated? And from what I've seen, they're all having this discussion and they end up no closer to the answer at the end of the discussion. You know, nobody wants to tell a member, you can't come in if you're not vaccinated, because that's a quick way to lose that member. On the other hand, we want people who have been vaccinated to feel comfortable returning to our facility, and some of them won't be unless they know that everyone around them has been vaccinated. Any thoughts in particular on the HIPAA issues? Can we require proof of vaccination?
So HIPAA is a specific statute that covers health information, and it doesn't apply to everybody everywhere, right? It doesn't apply just because you're an employer. You're not subject to HIPAA. That's a misconception. It applies to health plans. When you're getting health information, you of course always want to be sensitive, and people use HIPAA as a shorthand for like any kind of privacy law. So you do want to be sensitive when you're collecting that type of information. I think part of the question is, what are you collecting? Is it just proof of vaccination, or is it something more than that? So the EEOC has said that proof of vaccination, meaning that the immunization card itself is not medical information that needs uber duper super protection. It just is what it is. So maybe it's a situation where if you want to avoid getting into the realm of medical health, you look at an acknowledgement. I acknowledge that I've gotten the appropriate dosage of the vaccine. That way, you know, you're a little bit far removed from this idea of real pure medical information. That's where I tend to come down on it.
Thank you.
One last thing, Jenna. You mentioned, or I heard one of you mention, that feelings are not a protected class. If someone is, I see Miriam grinning because it didn't slip by many of you. So has that been tested? Or I get it. Somebody can say, I'm not comfortable, but that's not an illness. So I just was provoked to ask about that. You may not know, but let it be known. It's a touchy area.
Yeah, and words are important. So I can explain what I meant there. There are protected categories under the law, and they're set out. Race, religion, gender, we're kind of familiar with these. Disability, and what is a disability that has a specific meaning, and it's based on physical or mental impairment, and has to affect a major life function. So there's statute, there's regulations on this. It's not a feeling. Now there are states that certainly are trying to say that political opinion or conscientious objectors, that is a protected category. They're trying to make that a protected category. We've seen legislation pop up across the country on that. I haven't seen any of that pass in this context. I think that's like the next logical space to go. But right now, that doesn't fit under the legal definition of protected category when we're talking about getting vaccines in this context.
And another thing to keep in mind is, you know, if someone just says, well, I don't feel safe coming in, right, you know, that's not protected. You don't necessarily have to accommodate that. If they're pointing to a specific safety concern, though, if they say, well, you're, you know, violating the capacity limits, or you're, you know, violating OSHA guidance, you know, that's a little bit different, because then, you know, if you know, take some sort of adverse action against them, they could bring a retaliation claim saying, you know, I reported a legitimate safety concern and then I was retaliated against for that. So you do want to be careful about that. But yeah, you know, in general, if they don't have a, you know, a legitimate safety concern and they just feel like they don't want to leave their house, that's generally not protected.
I don't want to leave my house anymore. I get that. Anything else?
My wife wants me to leave my house.
Yeah. Anything else? Anybody else have any questions? Well, look, first of all, thank you both very much. And I want to remind everyone that next week, we're actually going to have a different slice, different way of looking at this, because we are going to be joined by Dr. Hilary Babcock, who is the medical director for BJC Infection Prevention and Epidemiology and a professor of medicine in the Infectious Disease Division at WashU. She's been helping to guide BJC on their reopening, and she has agreed to give us some time to share a little bit of her thoughts and feedback from a medical perspective about reopening concerns, what things are not concerns, and open to questions as well. So that will be next Thursday's call on the 29th. You are, again, welcome to invite whatever staff or lay leadership you want to participate in that. The week after, Mindy is going to be presenting the 2020 Community Investment Report. This is how Federation's dollars were invested into the community, which represents all of you and many more, including our COVID dollars. And then the week after that, or the week after, David Witten is going to come on to give us an end of legislative session kind of update and information. So thank you guys very much for helping to answer some questions. There will obviously continue to be, and I would encourage all of us to share our reopening documents and plans as we develop and get them. I know, as you could tell from Don's question, maybe the Federation is close to coming out with its thoughts on that. We're happy to share that, but as others do too, please, because it helps to know where others are sitting and feeling, gives a little bit of perspective. Might be helpful with your boards at times, I don't know, to say, you know, that other organizations are doing this or that, but might also be for those of you who are really unsure or a little further behind, some good language and thoughts and approaches to things. I don't have anything else specific. We don't have anything else specific on the agenda. Does anybody have anything that they'd like to bring up, share, or a concern or anything that they're hearing that's been going on?
Just a quick anecdote. We've been allowing up to 40 at our Shabbat services since maybe September, I guess. And we've been getting recently around 20, give or take. This week we decided, since the weather is getting better, hopefully it won't rain, we're going to do an outdoor kiddush for the first time since the pandemic started. And sure enough, we're at close to 40 now. So it's all about the food.
As it so often is in our tradition. Anyone else? Anything you want to bring up or share?
Can I say just real quick, I don't have a date yet, but I invite everyone. We're putting together a panel to answer questions about the vaccine, because a lot of people are getting it in our community, but there's still a lot of questions. And so I'll have more information shortly, but we certainly welcome anyone who has questions and wants to participate in a Zoom in the next week or two with physicians about vaccine concerns and questions and so on.
Rosalie, did you have your vaccine event yet?
The first vaccine is Sunday.
Oh, okay.
You have spaces available still, I saw.
We still have spaces available. The county health department talked with me this week several times, and they are finding really in the last 10 to 11 days that the availability of vaccine just keeps going up, and the people willing to get it are flat. So, you know, they're very concerned, and the rates, from what I understand at BJC, admissions are going up. So, you know, it's still scary out there. So we have availability, and thank you all for getting the word out. Appreciate it.
Well, one last thing that I'll just add, on our website, hushblackwell.com, we have a lot of various guidance related to COVID. We've got, you know, daily updates on every county and city and state in the country, and you can narrow it down to Missouri, to St. Louis County, or, you know, wherever you are. We've got a policy generator where if you want to return to work policy, you can enter in some basic information, and so this one I think is on a flat fee, and Jenna could tell me what the exact amount is, but it'll generate a policy for you if that's, you know, interested in. But most of this stuff, you know, is just freely available. Lots of guidance on there. Like I said, state by state COVID guidance, return to work resource pages. So, you know, feel free to check that out if it's helpful for you.
Fantastic. Thank you. Anyone else?
No? Anybody else?
I'll leave it to you.
All right. Well, I actually do have a request. In light of the really amazing conversation today, if you happen to see one of your friends or associates that's also in our Jewish community leadership that isn't on the call today or wasn't on the call today, mention to them how valuable these things are, because some who aren't attending may not realize just how great these are. And so if you can be an advocate for these community calls. I think that'd be really important. The more people we can involve in keeping ourselves up to date and learning more as a collective group, the better our overall community is going to be. So that is my request back to you with the end of the call, and wishing you a peaceful and restful early Shabbat and a great weekend. And we'll see you all next week.
Bye, guys. Thank you.
Thanks, everyone.